Okay, let's imagine you're dealing with that really severe, debilitating back pain. The kind that just completely disrupts your daily life. Your doctor suggests a pretty common and effective treatment, a targeted injection that might finally give you some relief. But what if that relief came with a hidden cost, a risk to your bones? Well, that creates a really delicate balancing act and a super important question.
And that's really the question we're diving into today. Is this common treatment the miracle cure it seems to be? Or is there a hidden risk we need to talk about? We're looking at that fundamental conflict between getting relief right now and thinking about your long-term health. It's a dilemma that, believe it or not, affects millions of people.
So what is this treatment we're talking about? It's called an epidural steroid injection, or you'll just hear it called an ESI. It's really a go-to procedure for doctors who are treating that intense back pain that's caused by inflammation, from things like a herniated disc or spinal stenosis. It's effective and it's used all the time.
So how does it actually work? Well, it's a very targeted approach, a powerful anti-inflammatory steroid, and in the study we're about to look at, the specific one is called dexamethasone, is injected right into the area around your spinal nerves. The goal is super simple: knock down the inflammation that's causing all that pain.
But, and this is a big but, here's the complication. The very thing that makes the shot work so well, the steroid itself, is also known to have other effects on the body. And one of those effects, a pretty significant one, has to do with our bones.
To really get the risk here, we have to talk about something called bone mineral density, or BMD. Now, the concept is actually pretty straightforward. Just think of BMD as the internal scaffolding that holds up your entire skeleton. The higher your density, the stronger that scaffolding is.
And this is where it all comes together. On one hand, we know for a fact that steroids can weaken that internal scaffolding, basically by speeding up how fast you lose bone. And on the other hand, you've got patients with osteoporosis, a condition where that scaffolding is already weak and fragile. So giving steroids to these patients, well, you can see how that can make a really bad situation even worse.
This brings us to the million-dollar question that doctors and researchers have been trying to figure out. How in the world can you give patients the powerful pain relief they so desperately need from an ESI without putting their already fragile bones at an even greater risk?
Well, to find an answer, we're going to dig into a study from the Pain Physician Journal. Researchers over in South Korea did what's called a retrospective study, which just means they looked back at existing patient data to see if they could get to the bottom of this exact problem.
So what they did was look back at patient records over 1 year, and they split them into 3 really distinct groups. You can see them here. Group 1 got both the steroid shot and a common osteoporosis drug called denosumab. Group 2, they only got the steroid shot for their pain. And Group 3 was kind of our baseline. They only got the osteoporosis drug. Okay, so let's just quickly run through the setup. The steroid was dexamethasone. The bone-protecting drug was denosumab, a very standard treatment for osteoporosis. And this is key. The patients were, on average, around 70 years old, and the researchers tracked all of this for a full 12 months. All right, this is it. This is the moment we've been building up to. What did the data actually show after 1 year? Did the steroid shots end up hurting the bones? And if they did that osteoporosis drug actually help? Let's find out. Whoa. Okay, the results for the spine were incredibly clear. Just look at that bar in the middle. The group that only got the steroid shot, Group 2, their spine bone density went down by 3.7%. But then look at Group 1, who got both treatments. Their bone density actually went up by over 5%, almost the same as Group 3, who are only taking the bone drug. And if you thought that was dramatic, the data from the hip tells an even bigger story. Again, the group getting both the steroid and the bone drug saw a small increase, almost identical to the group on the bone drug alone. But the group getting only the steroid injection, get this, they had a staggering 5% drop in hip bone density.
Let's just pause on that number for a second. A loss of over 5% of your hip's bone density in a single year. Now, for an older patient who already has osteoporosis, that is a huge increase in their risk of a fracture, all from a treatment that was supposed to be helping them.
I mean, the conclusion here was just undeniable. It looks like the osteoporosis drug, denosumab, completely canceled out the negative effect of the steroid on bone density. The group that got both treatments did just as well as the group that was only focused on building up their bones.
So, what does all of this mean for you, for patients? Well, this study really points toward a new way forward, a way to rethink this really tough choice between managing your pain and protecting the very bones in your body.
And you don't have to just take my word for it. Let's look at what the study's authors said in their own conclusion. They state that when denosumab is given alongside these steroid injections, quote, the steroid did not exhibit a significant effect on BMD. That's about as direct a finding as you can get.
So this whole thing really just boils down to these 3 simple steps. 1, we know steroid injections for pain can hurt your bone density. 2, this is a massive concern for anyone who already has osteoporosis. But 3, and this is the hopeful part, the potential solution here is that treating with a bone-protecting drug at the same time seems to wipe out that risk.
And that right there is the big takeaway. It's the most empowering message from this research. It suggests there's a future where patients and doctors can have a totally new conversation, one where you might not have to sacrifice your long-term bone health just to get some short-term pain relief.
And that leaves us with one final thought, one final question for all of us to consider, whether we're talking about back pain or anything else, really. Are you asking your doctor the right questions about the long-term impact of the treatments you're getting for short-term problems? Because that could be one of the most important conversations you ever have about your health.